I'm going to present 20 years of experience about eyelid rejuvenation without skin resection. The claim: since 12 years, I have a company in Argentina that distributes technology, laser, HIFU, and other kind of technology. Also, I research with engineers and anatomopathologists in what is the best way to use the technology. Now we are going to run a 10 minutes video. Thank you.
Blepharoplasty without skin resection.
Aesthetic blepharoplasty has a lot of complications, also in the hands of very expertise plastic surgeon.
Most frequent complications in conventional eye surgery with skin resection.
In this patient we can see that the eyes does not close completely. We can see an extensive scar. Almost all the skin of the eyebrow has been removed. The result of this conventional resective surgery is a permanent scar and a natural look. Unfortunately, this is a patient who will have to use the rest of his life eye lubricant because the eyelid that are the element of the protection do not occlude properly. In this patient we can see an extensive scar. The surgeon perfectly did not leave skin of the upper eyelid. The thick skin of the eyebrow descends completely to the edge of the eyelashes. The result of this conventional eyelid surgery are as follows: a patient with appearance of sadness, old age and fatigue, anti-naturally and anti-aesthetic scars. The conjunctiva present vascular reaction as the result of irritation produced by poor palpebral occlusion. The lower eyelid margin must be here. All this area of conjunctiva is exposed. These are complications difficult to solve. In this patient we can see in the lower eyelid sclera show. In the upper eyelid, so much skin was removed that the patient was obligated to shave the eyebrow hair completely and make a higher delineation.
To avoid this complication, since 1995, I developed a technique without skin resection.
From 1995, I have developed and improved the aesthetic surgery of the eyelid without skin resection, with which we can avoid this kind of complication. I present blepharoplasty without skin resection in countless national and foreign congress. This technique was presented in international journals and received the congratulations from the president of ISAPS for the contribution to the sciences. Now I'm going to present my personal technique and clinical results. The technique I describe takes the fat back out of the upper eyelid through a minimal incision. Here we can see the amount of fat back we remove. These fat backs give weight to the eyelid, make the look difficult and give an appearance of tiredness, sadness, and elderness.
Every eyelid is different. For this reason, I consider that each patient needs a unique kind of eyelid rejuvenation. For this reason, I do not make just only one type of eyelid rejuvenation. To decide what kind of treatment I will perform, I consider many situations. The position of the eyebrow is very important. The photo damage, if the patient have wrinkle or has not wrinkle. The upper eyelid bags, the lower eyelid bags, if the patient has malar festoons, and also is very important the social and labor activity of each patient. If we remove the skin of the upper eyelid, generally we give to the patient a sadness look. We can see in this patient a severe decrease of the eyebrow. We can see how the eyebrow are over the eyelashes. Also we can see a lot of fat back in the lower eyelid and the upper eyelid. Also we have an excess of the skin of the upper and the lower eyelid. This is the patient just 2 months later. This redness is because I perform a strong CO2 laser. I perform endoscopic brow lift, eyelid without scar, full face laser, also a facelift and laser liposuction of the neck. Thus we can see how can improve the face of the patient without removing skin. This is the patient 2 years later. We can see how improve the full rejuvenation of the lower eyelid, the position of the eyebrow, and a natural result.
This patient had a lot of upper and lower eyelid fat bags and upper and lower eyelid wrinkles. The therapeutic strategy consists on remove the upper eyelid fat bags through a stab incision, remove the internal, medial and external eyelid fat bags through a conjunctival incision, photorejuvenation and skin tightening using CO2 laser and microfocalizated ultrasound. Stab incision without skin removing, which Dr. Hoogstra created and developed since 1995, have the following benefits. Don't left an extensive scar in the upper eyelids. Don't descend the eyebrow. The descent of the skin of the eyebrow is frequently seen in conventional resective surgery, and in addition to producing an unnatural effect, it gives to the patient an appearance of tiredness, sadness, and oldness. Since 2016, Dr. Ricardo Hoogstra began to use the combination of CO2 laser with HIFU, using HIFU with 1.5, 2 and 3 mm head. The HIFU produced tightening of the skin and also orbitarium septum. The tightening effects of the HIFU let reduce the energy of CO2, getting the same or even better results with the faster recovery.